Hello, hi, namaste. Let's discuss about the prognosis of the acute lymphoid leukemia. It has, of course, good prognosis and poor prognosis. But question is that in which conditions the patient have good prognosis and in which conditions the patient have bad prognosis, means poor prognosis. Okay, then first factor is that age factor. If the patient age vary between the 2 year to 9 year, then in case of the acute lymphoid leukemia, the patient have a good prognosis. But if the age of a patient is less than 1 year or greater than 10 year, okay, greater than 10 year, then patient has a bad prognosis. Okay, then patient has a poor prognosis. And if the patient is female, then it has a good prognosis. But if the patient is male, then it has a bad prognosis in case of the acute lymphoid leukemia. Okay, in case of the total leukocyte count, if we focus, then the question said that that if the leukocyte count is less than 10,000 per microliter, then in this case the patient have a good prognosis in case of the ALL. Okay, but if the total leukocyte count of patient is greater than 2 lakh per microliter, in this case the patient have poor prognosis in case of ALL. Okay, if you focus on in the general examinations, then like hepatosplenomegaly, there is enlargement of the liver, splenomegaly, and spleen, and lymphadenopathy, enlargement of the lymph nodes, and mediastinal mass. There is mass in the mediastinum. If all are absent in a patient in case of the ALL, then patient have good prognosis. On the other side, if all are present in patient, then patient have bad prognosis in case of the acute lymphoid leukemia. Okay, if patient develop CNS leukemia, in case of ALL. What is CNS leukemia? CNS leukemia means uh, progressive of the leukemia to the brain, spinal cord, meninges, and that leads to the further damage of the central nervous system and the abnormalities called CNS leukemia. And in this case, if the CNS leukemia present in a patient, then poor prognosis. If absent normal, there is good prognosis. And polyp if the patient have greater number of chromosomes than usual in the cell, then there is a good prognosis. If less number of chromosomes in the cell than usual, then it is a poor prognosis. And if the patient have good response treatment, then good prognosis. Of course, there is a good prognosis. If the patient have poor response treatment, then it's a poor prognosis. And is a minimum residual disease if less than 0.01%, so good prognosis. And if greater than 0.01%, this is of course is a bad prognosis. Okay, and this is the prognosis of the AL. Okay, AL prognosis. Okay, thank you.